A stage 4 cancer patient says she was set up to fail by her insurance company. Tonight, she's calling for change after discovering a practice that keeps patients from getting the most effective treatment. Our 13 Investigates reporter Sandra Chapman shows you tonight how insurance providers can deny doctors' orders and force patients to try less effective or lower cost options first.
It really helps me. I can feel the prayers.
A wall of well wishes, loving reminders of the army of supporters fighting for Molly Fetzer.
When I'm not feeling well, you just kind of pause and think about all the people.
In November, the 37-year-old mother and special ed teacher woke up with a numb jaw and flu-like symptoms. Within a matter of weeks, a grim diagnosis. It was stage 4 metastatic breast cancer.
There are spots on my liver and my bones and my brain and breast.
Molly's team of doctors planned an aggressive attack, starting with Verzenio.
New everyday Verzenio, the only one of its kind that can be taken every day.
The new breakthrough drug on the market for over a year was considered the most effective choice by Molly's oncologist. But Molly's insurance administrator denied coverage for the drug. The reason? Medical necessity. In this letter, Anthem said Verzenio could be prescribed only after Molly had undergone chemotherapy or some other treatment.
They want people to go through what they call step therapy or fail first therapy, meaning take a form of treatment that isn't the most current, isn't the newest. You have to take that and then have that fail before we'll pay for the newer FDA-approved treatment.
Groups all across the country are now pushing back against step therapy, saying patients are suffering while being forced to endure a series of ineffective treatments. At least 20 states have passed legislation regarding the practice. In 2016, Representative Donna Shabley and other Indiana lawmakers cleared a way for patients to appeal step therapy for the denial of prescription drugs. But there's no law to address other treatments.
When you're in a situation like that, time is of the essence in order to get treatment that's appropriate for you.
For Molly, a state law wouldn't matter anyway because of her type of insurance. Westfield Washington Schools is a self-funded insurance program with no state oversight. The district itself pays the cost of coverage, but contracts with Anthem to make medical determinations.
You hope to not need it, but when you need it, it's supposed to be there.
Molly appealed Anthem's decision on Verzenio. At the same time, Anthem also denied a new radiation technique to target lesions on Molly's brain that would significantly reduce the risk of severe memory loss. Some doctors consider the memory-sparing technique a new standard of care, not Anthem.
It's not right.
Molly's father and Representative Shabley say insurers want to cut dollars and cents. According to 2014 Medicare costs, the traditional radiation costs $6,500 per treatment. The new memory-sparing technique about $10,000. Molly's overall treatment cost $106,000.
You can't put a price on that.
Why expose them to a higher risk when there's an equally effective treatment available just because it's 25% or something more expensive? I mean, to me, that's putting dollars over a patient's health.
Days after 13 Investigates questioned Anthem about its denials, the insurance company reversed its decision on Verzenio and approved it. But Anthem wouldn't budge on the memory-sparing technique and refused to explain why.
I can't believe this. We're going to have to go back and fight them.
Finally, after 7 weeks of turmoil over insurance, all while battling stage 4 cancer, a bargaining unit at Westfield Washington Schools voted to override Anthem, its insurance administrator, and provide the coverage for Molly. Now, for the first time since her diagnosis, she can focus exclusively on her health.
I am trusting, praying, having faith that it's going to work out the way it's supposed to.
Anthem did not provide its policy on step therapy. In a statement, the insurer said 2 radiation oncologists reviewed Molly's case and decided the treatment did not meet the criteria under her employer's plan. Now, Anthem said the decision does not prevent or advise against treatment, but it would have meant that Molly would be paying out of pocket for radiation. And of course, that's why we have insurance.
This is so frustrating for these patients. They're fighting their health battle and fighting the insurance.
Yes, it is.
So what should you do if you're denied coverage?
There are 3 things that you can do, Scott. Ask for a detailed explanation for the denial. file an appeal to the insurance provider. And depending on what kind of insurance you have, you can file a complaint with the state if you have traditional insurance, or with your benefits coordinator if you are part of a self-insured plan. We have all of that information and so much more at WTHR.com, and we hope that it will help others out there facing the same thing.
Yeah, that's great advice. Sandra, thanks.